Hi, I am Dr. Eric Ko, a hair transplant surgeon in Korea. Today, I will be covering most frequent hair transplant mistakes patients make and how to avoid them. They are really important for your graft survival. So please enjoy the video and hit subscribe.
Hair transplant regret. It's real, it's emotional, and it usually starts with someone saying, "It looked good in the brochure." I'm Alex. I ask dumb questions so you don't have to. To walk us through the biggest mistakes and how not to end up on the botched hairline hall of shame, here's a real expert, Dr. Ko. Regret number 1. Bad hairline design.
A poorly designed hairline can immediately make someone look unnatural, even if the grafts were technically well placed. The goal isn't just to lower the hairline, it's to design one that enhances the entire face, both now and in the future. Usually, when designing a hairline, we divide the face into thirds. 1. From the hairline to the glabella, between the eyebrows. 2. From the glabella to the base of the nose. 3. And from the nose to the chin. Ideally, these segments should be balanced. So, if someone has a long forehead, we can restore proportion without placing the hairline too low. We also consider gender and bone structure. Men generally benefit from a slightly angular M-shaped design. It creates a more defined masculine forehead. Women, on the other hand, often need a softer, more rounded contour. When done correctly, a hairline should frame the face naturally and age gracefully. That's why designing it isn't just about drawing a line. It's about architectural planning, anatomy, and long-term vision.
Wow, who knew your forehead had a blueprint? Thank you, doctor. And also, thank you, geometry. Next, the poor density. You paid, you healed, you even waited 6 months, but under bright lights, it's still see-through. Dr. Ko?
This is one of the most common frustrations I hear from patients who've had surgery elsewhere. They were promised 3,000, 4,000, sometimes even 5,000 grafts. But when I examine their scalp, I see poor coverage, patchiness, or density that breaks apart in lighting. It's important to understand that the number of grafts alone doesn't guarantee good results. It's about how those grafts are used and where they're focused. If they're spaced too far apart or scattered over too large an area, you won't achieve cosmetic density, no matter how high the graft count sounds. We design the plan based on each patient's unique hair loss pattern. For example, if someone is losing primarily in the frontal zone, we concentrate grafts densely in the frontal core and temples, where the eye naturally focuses. Trying to cover too wide an area with limited grafts dilutes the effect and makes the result look thin. For most patients, we aim for at least 40 to 50 grafts per square centimeter in the visible frontal zone. That's the area people see when you talk, meet, or take photos. It's far better to restore a smaller area with strong visual density than to chase full coverage with low impact. Another factor is survival. Grafts must be handled delicately and implanted quickly. If they dry out, are crushed, or placed at the wrong angle, they won't grow properly. We use organ preservation solutions, Sapphire blades for precise incisions, and strict timing protocols to improve survival rates. It's microsurgery, not just placement. That's why patients should ask their surgeon. 1. What density are you planning per zone? 2. How will you store and preserve grafts during surgery? 3. What tools are used to reduce trauma and increase precision? Remember, the eye focuses on density, not square footage. So, instead of chasing coverage over the whole scalp, we create concentrated, natural-looking zones of thickness. That's what delivers satisfaction and realism.
Regret number 3. Poor aftercare. You followed every instruction until you got home and scratched your head in the shower.
The truth is, the success of a hair transplant doesn't end when the surgery does. The first 7 to 10 days after your procedure are critical. That's when the grafts are most vulnerable. They haven't anchored into the scalp yet. Even minor trauma can dislodge them. I've seen patients ruin good grafts with things like rubbing with a bath towel, washing under high-pressure showers, going jogging on day 2, wearing a tight baseball cap because it looked fine. We advise patients to treat their scalp like a surgical wound. That means no scratching, no sleeping flat on your face, and no heat. That includes saunas, hot hair dryers, or excessive exposure to sunlight. Best practices include: use sterile saline spray to keep grafts moist. Wash gently with room temperature water using a soft pour, not direct stream. Sleep with your head elevated at a 30 to 45 degree angle to reduce swelling. Avoid alcohol, nicotine, intense exercise, and swimming for at least 2 weeks. We also recommend sending follow-up photos during the recovery period. That allows us to guide patients in real time and catch any early signs of inflammation, infection, or missteps in care. Think of Aftercare as your second surgery, one that you perform at home. If done right, it protects everything we've achieved in the operating room.
Last but not least, regret number 4. Expecting magic instead of medicine. Take it away, Dr. Ko.
One of the most important conversations I have with every patient is about expectations. Hair transplant is not an instant transformation, it's a gradual biological process. After surgery, you won't see results in days or even weeks. They begin at around 3 months and peak at 9 to 12 months. Hair grows in cycles. The follicles enter a resting phase after surgery, and shedding of the transplanted hair is completely normal in the first few weeks. Many patients panic when they see this, but it's part of the natural timeline. Also, many patients assume one session will give them full density across the entire scalp. But depending on the extent of hair loss and available donor supply, we may need to stage the treatment in 2 or more sessions. And lastly, surgery doesn't stop hair loss. If you're still losing native hair, especially in areas we haven't treated, you may need medical therapy like finasteride or minoxidil to maintain the overall look. Realistic expectations include gradual, natural growth, not overnight change. Potential need for a second session for full coverage. Ongoing medical therapy to preserve native hair. A more mature age-appropriate look, not a teenage hairline. My goal is always to deliver a result that looks natural, enhances your appearance, and lasts for years. But that requires planning, patience, and understanding the biology of hair growth, not just chasing a photo you found online.
So, what did we learn? Hair transplants work when done right, and that means planning, precision, and patience.
Hair transplantation is both science and art. If you take the time to plan it well and work with a qualified team, it can be one of the most rewarding investments in your confidence. If you're considering a hair transplant, educate yourself, ask questions, and make a long-term plan. It's not about chasing a trend, it's about making a smart, personal medical decision